Welcome, everybody, to Nutrition Management and Multidisciplinary Approaches in GIST. I don't know if anybody knows this, but March is Nutrition Awareness Month. So we're very, very excited to have this topic featured this month in March. During this seminar, all participants will be in a listen-only mode. There'll be questions and answers at the end of the presentation, and you can submit those questions through the Q&A feature. Please remember that information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sarah Rothschild, and I'm the Executive Director of the Raft Group. We would like to thank Cogent, Genentech, IDRx, and Novartis for their educational grants for today's webinar. And now I'd like to introduce our presenter. Ms. Berenice Carbajal-López is a doctoral student who holds a master's degree in health sciences with a thesis related to the use of technologies in the nutritional and psychological care of patients with GIST. She has a diploma in clinical research and biostatistics at the National Cancer Institute in Mexico. She has experience in healthcare of GIST patients as a patient care coordinator from 2014 to 2019 and as global director since 2020 at Fundación GIST Mexico. Ms. Carbajal-López has also collaborated in drafting and review of research articles and book chapters in the area of oncology, with 8 publications to date as main author and co-author in index journals, and has participated in national and international congresses. She is probably the most well-versed nutritionist in GIST that I know of, and it is an honor to have her today. So I'm gonna have her get started on the presentation, and feel free to ask questions in the chat. All right, take it over.
Hi, Sarah, thank you so much for your presentation. I'm going to start sharing my presentation. Okay, well, please let me know if you, okay, now I'm sharing, I guess. Okay.
Yes.
Thank you very much, Sarah. So today I am here to talk about nutritional management and multidisciplinary approaches in GIST, but I would like to start to introduce also myself. As Sarah mentioned it before, I am Berenice Carbajal. I am so glad to be here with you. I would like to start also thanking Sarah and Rebecca and all the allergy team that works really hard to make these webinars happen. And it is a huge date for me because as Sarah mentioned it you before, this is March, the National Nutritional Day. So I am really glad to be able to be here with you, specifically talking about the importance of the nutritional management in all the GIST patients. And of course, the effects of multidisciplinary approaches in order to get better outcomes for these patients. So I would like to start with an overview of the topics I'm going to share with you today. I'm going to start with the onco-nutritional pathway. I'm going to explain a little bit about what is an onco-nutritional pathway and why is this so important for us as GIST patients. Also, I'm going to get to the importance of screening for malnutrition, why this is so relevant for us as GIST patients. And then we are going to assess the nutritional assessment interventions and also the aspects of a fundamental nutritional management regarding the treatment, including surgery and TKI side effects, okay? And here I'm going to take a little more of our times speaking about the nutritional coping with the side effects related to TKIs and the disease itself. So let's start with the first topic. I would like to explain to you the importance and the definition of the onco-nutritional pathway. As pathway, I related to as the steps we are going to take when we get the diagnosis of GIST. As you may know, we first start with a proper diagnosis. Then we have to go through a disease staging, because depending on the stage of the disease, we are going to go through a surgery or we are going to get first line therapy in this case scenario will be imatinib, okay? And then when we are ongoing treatment with imatinib, or when we are on surveillance after surgery, we have to get a follow-up and some periodical reevaluations. And if it's needed, we might get some access to a second-line therapy. In this case, might be sunitinib. But it is important to be aware that aligned to all these oncological pathway is a metabolic nutritional pathway related. This must start since the disease staging, and this must include an screening and assessment, because you might have some risks related to malnutrition that need to be addressed, okay? I'm going to speak a little bit more in the other slides, but it must start with a screening and assessment. And then you may need nutritional and metabolic interventions. You might also need follow-ups and periodical reevaluations in order to be assured that you are getting a proper intervention for your risk or your possible risk you are going through. And also, maybe you maybe require some metabolic strategies in order to help you cope properly or to get a better nutritional status. So it is fundamental to start this pathway aligned with the diagnosis of the disease. It is fundamental, of course, to try to address these nutritional risks in order to get a proper nutritional assessment, because it might help you to enhance clinical functionality, adherence to treatments, and of course to reduce side effects related to surgery or the TKI's treatment, right? So, but why is screening for malnutrition is so important? Well, there are several aspects related to malnutrition, including muscle loss, increased toxicity from chemotherapy or from other TKIs, reduced tolerance to anti-cancer therapy, reducing dependence on, of course, quality of life, higher complications and risk of infections, okay? And of course, larger hospital stay greater than 3 days if you are not ongoing with a proper nutrition through your medication. So it is really important to be aware of the risks we might be through to can assess them properly, right? And well, malnutrition screening must be multifactorial, because there are several risks and functions that can be related to this. As you may see, after cancer diagnosis and along all the cancer treatment, patients must need to be evaluated to identify possible risk factors associated to malnutrition. Which of these risk factors might be? It includes weight loss, anorexia, sarcopenia, inadequate food intake, body mass index, cachexia, of course, and systemic inflammation. And if your oncological team or your registered dietitian identifies any of them, you as a patient must need an assessment for malnutrition. And of course, considering that these risks might have a multifactorial cause and may need a multidisciplinary approach in order to get an adequate assessment to you as a patient. So there are several aspects involved in malnutrition or the risks for malnutrition when we are ongoing a treatment for GIST or for any other type of cancer. So also, the American Society of Parenteral and Enteral Nutrition also established the assessment of for proper or a proper assessment in order to identify these risk factors for malnutrition, not only at the beginning of the disease, but also they recommend to make a follow-up through all the medications or the treatment you are receiving as GIST patients. And they also recommend to consult with a registered dietitian to have an adequate nutritional assessment. Remember, we need to get these type of screenings not only at the time of the diagnosis, but also not only at the time of the diagnosis or when starting a new drug or when starting a new treatment, but it is fundamental to get this type of screenings all along your disease, all along your clinical therapies. The ideal scenario would be that you receive these type of screenings for risks of malnutrition every time you attend to your hospital to a clinical evaluation. Nutrition must be also a reevaluation status so you can get a proper benefit from an adequate therapeutic nutrition assessment. So we at Fundación GIST Mexico do these nutritional screenings every time we contact our patients to evaluate if our patients might need help regarding nutritional aspects or in order to enhance TKI's adherence to treatment, because we can assess if our patients are not doing very well with the treatment, and we can help them to cope with the side effects with some strategies regarding therapeutic nutrition. And well, which are the benefits of a therapeutic nutrition? As you can see in this figure, there are multiple benefits from getting a proper therapeutic nutrition, which might include reduced side effects, enhanced benefits of chemotherapy, reduced incidence of anemia. As you recall, anemia is one of the main side effects related to imatinib. So you can get a proper assessment and you can get a proper indication for therapeutic nutrition in order to help you to cope with anemia. Also, you can prevent malnutrition, protect vital organs from toxic agents, increase enjoyment of food, of course, improve your quality of life overall. I know it is not the best scenario when we are going through so much drugs, but you can improve your quality of life and, of course, to maintain health post-treatment only with an adequate assessment for nutrition. So it is fundamental for you as patients to really consider attend to a registered dietitian consultation to get this type of support at your facility. And of course, it is fundamental to have an adequate adherence to the treatment your dietitian asks you or your dietitian suggests. I know it might be difficult to introduce a different type of diet in your family, but because it might be really different of what you have been used to eat, and now you have to eat some other foods that you were not used to it or you didn't like before. But believe me, it's worth the cost when you are facing this type of treatments and when you are getting better with nutrition and with your therapeutic approaches. So speaking of therapeutic nutrition related to the oncological pathway, I would like to start talking about the nutritional intervention related to treatments. And I'm going to begin with surgery. There is a protocol really established, not only in the US, but also here, by example, here in Mexico, in the National Cancer Institute, they do this protocol for surgical patients. It is named Enhanced Recovery After Surgery Program, the ERAS protocol. This protocol was developed in order to minimize the metabolic stress associated with surgery in undernourished patients. But nowadays, it is recommended for all cancer patients undergoing either curative or palliative surgery. This type of protocol have specific aspects related to the therapeutic nutrition in every step of the way, including preoperative, intraoperative, and of course, postoperative scenarios. And in every scenario, they have different goals in order to achieve better outcome for the patients. And this protocol has demonstrated to reduce morbidity and mortality after surgery, and of course, to enhance recovery after this type of procedures. So this is a well-established protocol in all the hospitals that are treating cancer patients. I suggest, I think you might have this protocol and you didn't recall it, but it is a well-established protocol in order to get better outcomes for you as patients after surgery. And well, later after surgery and a proper risk of recurrence assessment for GIST, some patients might need a TKI treatment, or they might need a TKI as the first-line therapy, depending on the clinical stage. And as you may know, the first-line therapy in GIST, as I mentioned to you before, is imatinib. But which are the nutritional concerns with this amazing therapy? Of course, the side effects. As you see, gastrointestinal side effects are important and are the first one listed. And these type of side effects are really important for us as dietitians, because these type of side effects can impair the adherence to treatment. So nutritional screening and therapy must be aimed to ameliorate these side effects and of course to enhance the adherence, and of course to enhance your quality of life overall when you are ongoing imatinib or sunitinib, of course. So I am going to take a time to describe all these side effects related to treatment, and of course, the ones which are related to the disease itself, in order to give you some ideas to cope properly with them, with some tips of nutrition and what to eat and how to avoid them, or how to relieve these type of side effects. So I am going to begin with cachexia, which is the main concern of nutritional status and is the first side effect related to the disease itself. But why does cachexia happen? Well, cachexia is a metabolic scenario that contributes to adverse changes in muscles, fluids, metabolic energy functions, and of course, immunosuppression. Cachexia has several factors involved, including loss of skeletal muscle mass, age-related sarcopenia, poor nutritional status, physical inactivity previous to the disease, and of course, all these four of them are previous of the disease. And of course, the one related to the disease itself, including metabolic disturbances, increasing of energy expenditure, inflammation, protein breakdown, and of course, the loss of protein synthesis and loss of appetite. And there are also another aspects or factors involved related to the treatment itself, including tumor obstruction and cancer symptoms, such as loss of appetite, of course, loss of nutrient absorption, nausea, vomiting, diarrhea, constipation, dysphagia, depending on the tumor site, and also changes in the smell and tasting of the foods. So there are several factors involved in here which may impair you to eat properly, and of course to cause a scenario of cachexia. But when regarding a proper therapeutic nutrition approach to this, we have to be aware that the medical nutrition care must depend on the nutritional and metabolic needs of every patient. Cachexia is divided into 3 different types of cachexia, including pre-cachexia, cachexia, and refractory cachexia. Okay, patients with ongoing treatment often are diagnosed or have symptoms of pre-cachexia or cachexia. Regarding refractory cachexia, is mostly related with patients in palliative care who may need palliative nutrition intervention, which is a completely different scenario. So I'm going to focus in the first 2 of them. And in these 2 first ones, we might need nutritional counseling, of course. We might need fortified foods, and of course the ONS related to consider inclusion of anti-inflammatory ingredients, and also maybe you might need immunonutrition in this scenario. So it is really important to be aware of this, and if you have some of these aspects related, you might ask your registered dietitian in order to get a proper medical nutrition care. But it is really important to be aware that cachexia in all its modalities need to be addressed with a multidisciplinary approach, and has different approaches that may include a proper risk assessment. And early detection of cachexia is fundamental, and of course, a proper diagnosis, even if we are talking about pre-cachexia or cachexia. And in both of them, we might need a proper management. This management must be related to a cachexia clinic, must have a proper assessment, a proper intervention, Of course, they have to be surveillance, they have to make follow-up care, and they have to palliate all the side effects related to this in order to get the better outcome for the patients. And of course, to reduce the failure after the treatment or after the proper medical treatment for cachexia. So this, I would like to address that must be multidisciplinary, okay? You must have all your team collaborating in order for you to get the better outcomes. And as I mentioned to you before, there are other symptoms related to treatments that may be affecting or may be perpetuating cachexia or maybe getting it worse, right? And those are the symptoms related to the treatment itself. So I'm going to start addressing them. I'm going to talk first about nausea and vomiting. As you all know, nausea and vomiting are related to the treatment to TKIs, also are related to radiation, immunotherapy, but also have demonstrated to be associated with pain, fatigue, mucosurium, constipation, and of course, some other medications. There are 3 types of nausea and vomiting, including acute vomiting, delayed, or anticipated to treatment, okay? There are some medications that some oncologists use for pain that also can be causing nausea and vomiting, and they can be presenting acute, delayed, or anticipated to the treatment. So it is really important for you to be aware of which of the medications you are taking are maybe promoting you to have nausea and vomiting, right? So what can we do? Well, you can eat small frequent meals, avoid empty stomach, because remember, when you have empty stomach, it's also related to a poor microbiota and also related to symptoms of gastritis, and gastritis is also have these symptoms of nausea and vomiting. So please avoid empty stomach. Also eat cold room temperature foods, avoid strong odors, maybe use mints, root beer, or sticks with lemon drops. These really help our patients to cope with nausea and vomiting. But remember, in case these tips doesn't work for you, do not work for you, you might need to ask your oncologist for a proper medication for nausea and vomiting, because in some scenarios, you have to get medication for this. And well, another type of symptom related to this TKIs treatment is diarrhea. And diarrhea have multiple aspects related to it. So it has diet intolerance, metabolic stress, intestinal dysbiosis. Remember that intestinal dysbiosis is named as this imbalance in the good microbial community that is associated with the disease, okay, or the treatment you're receiving. So you have this imbalance in your microbiota, and then you have this inflammation or this imbalance, and this can be causing the diarrhea, right? Also, some other medications can be causing diarrhea, including the TKIs, but other medications can also have this side effect. So it is really important for you as patients to be aware of the severity and the frequency of the diarrhea, because uncontrolled diarrhea can lead to dehydration and malnutrition. And in the worst case scenario, would lead you to a hospitalization and often to an acute kidney failure. So it is really important for you to be aware of the, again, severity and frequency of the diarrhea, right? So what can we do at home? Well, we can limit insoluble fibers and increase soluble fiber, possible lactose restriction, limit fatty foods, caffeine, very sweet food, or gas producing vegetables, and of course, consider the use of multivitamins if you need so. So one of the most important aspects of diarrhea management, of course, is the microbiome or the microbiota. As you all know, I am a huge fan of microbiome and all the association of this microbiome to the oncological pathway. Of course, recently, microbiome has become one of the hallmarks of cancer. So I am a huge fan. We are not going to go there today, but I'm going to use only this acute information to make you understand the role of microbiome in the management of some side effects. As you can see in this figure, some treatments used to imatinib or to other type of cancers, including TKIs, radiation, other types of chemotherapy, and also antibiotics, can cause decrease in diversity and increased pathogens. It can also cause increased damage in the mucosa and blunted villi. And of course, they also can cause increased immune tolerance and immune evasion. All these three factors can promote or enhance or can aggravate these type of symptoms you are ongoing, right? Including diarrhea, malabsorption, or cachexia itself. So it is fundamental for you to be aware of your microbiota and to promote a healthy microbiota in order to cope properly with these side effects or to help you the relief of these side effects, okay? But how can we improve our healthy or microbiota, or how can we get a healthier microbiota? Well, we can do it with the diet. Okay, in this figure, I want you to represent these the principles in utilizing the food microbiota axis. Remember, we have the host parameters that are related to our microbiota, including demographics, location, environmental exposures, genetics, and of course, other medical conditions you might be diagnosed before GIST. And then we have the gut microbiota parameters, okay, which are referred as the quality of your microbiota. And then we have the aspects related to diet that can help us to get a healthier microbiota, including the timing of your food, the quantity of the food, okay, the content of your meals, okay, including macronutrients, micronutrients, and of course, the use of prebiotics and probiotics. So these aspects tell us that it is fundamental to be aware of how through the diet, through a healthier diet, which might be a diet rich in fruits and vegetables, low fat, low sugar, through this healthier diet, we can enhance our microbiota and of course, reduce incidence and severity of all the gastrointestinal side effects related to treatment, including cachexia itself, right? So I want you only to take a time and to understand why it is so important to be aware of your gastrointestinal health, okay, and to address if you are having one of these gastrointestinal side effects. This might help you to get a better adherence to treatment, okay, and to tolerate better, and of course to get a proper nutrition and not to get under these risks for malnutrition, right? Well, I'm going to take a time to talk about another side effect that you all might be related to, because it's one of the leading side effects regarding GIST and regarding this TKIs treatment, including imatinib, sunitinib, and regorafenib. So I would like to talk about fatigue. It is already established fatigue as a syndrome, okay, named as a cancer-related fatigue syndrome, which is, as a definition, is an unusual and persistent feelings of physical, emotional, and or cognitive fatigue, okay? You feel exhausted all the time, okay? And this might be related to cancer itself or to cancer treatment and interferes with your normal activity, okay? I don't know, to make you more clear, if you were good at math, you are no longer good at math. Okay, if you remember all the cell phone numbers of your family and friends, you can't recall them anymore. You forget constantly about where are my keys, where did I park my car, I can't remember anymore. Okay, and this is a side effect not only of imatinib, but also related to the disease itself. These symptoms, I mentioned it to you before, must be related to cognitive fatigue. But of course, we have emotional fatigue and physical fatigue, okay? And there are some aspects related to this syndrome related to the disease and the treatment that are interacting with the cancer-related fatigue, including direct effects of cancer and tumor burden, treatment and side effects, comorbid medical conditions, exacerbating comorbid symptoms, and of course, all the other ones related to the psychological distress you are ongoing when you have these treatment-related side effects, okay? So we can also cope with nutrition and with the symptom, and we can also cope with, remember, which one? Exercise, okay? The American Cancer Society describes to us how to rehab from cancer-related fatigue, beginning with exercise, okay? They tell us exercise is recommended to decrease fatigue and improve mood. Also, aerobic exercise can help us to improve capacity and reduce fatigue, okay? And also can prevent bone density loss and loss of strength. They also have demonstrated that physical therapy helps to alleviate nerve damage and restore agility, and of course can reduce or eliminate need or opioid medications regarding to pain, okay? So we come back with the fact of a proper nutrition and coping with side effects requires a multidisciplinary team approach, because we can supplement with magnesium and B12 for fatigue, we can increase protein intake, but if we do not exercise, the rehab from cancer-related fatigue might not be as successful as we expect it to be, right? So we have to do several things in order to cope better with these side effects, right? And also, it has demonstrated that physical therapy prevents tumor metastases through modulation of immune function. How does this happen? As you know, physical activity reduces inflammation overall, and therefore have an impact of the modulation of your immune system, and there is how it is associated to a reduced risk of metastasis in other types of cancer, okay? Also, exercise have been related not only with the fatigue relief, but also with enhancing a good microbiome. As you can see in this figure, a progressive increase of physical activity level generates changes in the intestinal microbiota. And therefore, we have more abundance of good bacteria to go better with all the other side effects I already mentioned it before, including all the gastrointestinal and of course, cachexia, which is really important for you to be aware of this. And besides the immune modulation, the enhance of good bacteria, and the fatigue relief, exercise also improves overall survival. In this study, they included cancer survivors comparing the METs, which is named as the metabolic equivalent of task. I mean, the metabolic impact of the physical activity you are doing, okay? So they included patients and they divide them into 3 groups: less than 3 METs hours per week, 3 to 18 METs hours per week, and of course more than 18 METs hours per week, okay? And they as you can see, the patients who did more than 18 METs hours per week had a better overall survival compared to the other ones. So it is really important to be aware of, try to introduce physical activity in your daily basics, okay? You can start slowly with a physical program or a physical therapist, but it is important. And here is the question everybody asks me, or asks all the other physicians or all the other registered dietitians. What type of exercise is recommended for me? Well, the American College of Sports Medicine Guidelines for Cancer Survivors describes 3 types of exercise: aerobic, resistance, and flexibility. And they recommend us to try at least one of these 3 of them, at least 2 to 3 days a week, in order to achieve at least 150 minutes per week, okay? Also, the American Cancer Society describes these 3 types of exercise and explains us the benefits for different types of exercise, including reduced anxiety, fewer depressive symptoms, less fatigue, better quality of life, improved perceived physical function, of course, and of course, no risk of exacerbating lymphedema. So this translated to the daily basics. How can I start? Well, I can start only by walking my pet, stretching at home, do a stationary bike, some yoga, and if you have the opportunity, you can start swimming. But remember, you have to ask your physical therapist or you have to ask your oncologist which type of exercise is better for you regarding your treatment or your medical condition, okay? So it is important only for you to be aware that the American Society of Cancer recommends this type of exercise, at least 30 minutes of moderate to vigorous physical activity, okay? And this has to be over and above usual activities, okay? Your brain needs to catch up. And this is how I explain to my patients. I am sorry, I'm walking all the time. Of course, I work out. No, you have to walk over and above usual activities. Your brain has to catch up. You have to change your clothes. You have to go out and tell your brain, I'm working out, okay? In order to you get this proper benefits from workout, okay? And it's important for you to remember that this has to be at least 3 times a week, okay? So in this degree, it is really important for you to be aware of your nutritional status, because a good nutritional care can deliver better health outcomes and save costs, okay? Why? Because it might help you to weight gain or maintain your ideal body weight. It can decrease interruption of rate of oncology therapy, because if you are not well nourished, you might need to suspend your treatment with imatinib. So it is really important to address, can achieve these therapeutical doses in order to get a better response to this anti-cancer therapy, right? And of course, nutritional intervention allows us for cost savings, not only for the healthcare systems, but also to you and your family, okay? So a better nutrition leads to a better outcomes, okay? It is important for you to be aware of what you are eating, and to try to mix fruits and vegetables, okay? So I'm going to give you, to end my presentation, give you some general recommendations. Please take your time. First of all, please take your time for recovery from your treatment and side effects, okay? Your body is going through a lot, okay? You are going through a lot. Please take your time. Please take a nap. Please rest. Please get okay with getting help from your family and friends, okay? Take your time to recover properly, okay? Be patient with yourself, okay? Then it would be magnificent if you can achieve or maintain your ideal body weight, okay? Decrease your fat intake, choose plant-based diet. With this, I recall it as try to include more fruits and vegetables into your daily basics, okay? Try to mix textures, try to mix ingredients, colors to make it more delightful for you, and in order to make it also more healthier for you, right? Try to do regular physical activity, of course, and please ask your oncologist which might be the better option for you in this aspect of the physical activity. Drink alcohol in moderation. We do not recommend to drink alcohol to our patients, but if your oncologist says it's okay, well, it's okay. Of course, limit consumption of red and processed meats, and limit your salt intake. And please, 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 please drink enough water, okay? If you are feeling thirsty, you are already dehydrated, okay? And I will want to recall also one tip one oncologist gave us to us in one this day of learning. She told us that if you don't feel annoyed by the times you go to the bathroom, you are not drinking enough water. So I will invite you to get a healthier lifestyle, try to incorporate these tips into your daily basics, and hopefully you can feel better and you can cope better with your side effects, right? So I will want to share with you this Hippocrates quote: let the food tie your medicine and medicine be tie your food. And I'm so glad to be here. Thank you again for your time. And I'll also be glad to answer all your questions. Thank you very much.
Thank you, Berenice. Excellent presentation. We do have questions that have come in, but you're also welcome to type your questions in the Q&A. So feel free to do so. I am going to get started with some questions. So there's some coffee drinkers here. The question is, what are your thoughts on coffee or a pre-workout powder while on imatinib?
Okay, well, my only concern with coffee is the tolerance, because in some scenarios can cause inflammation. As you all may know, coffee might be related to enhanced gastritis symptoms. I mean, neither the coffee nor the pre-workout powder is contraindicated with imatinib. Just please do not consume these ones when fasting, okay? Try to eat first your probiotics, then a healthy breakfast, and then you can try coffee or any other pre-workout powder. Because then if you don't do this way, you might be thinking imatinib is causing this inflammation you might have, or this irritation in your stomach, and you are correct, but you are perpetuating or you are aggravating with the coffee when fasting. So please, my only concern is do not take coffee when fasting. That will be my only recommendation.
Okay, thank you. This person had a resection of their GIST tumor in their small intestine. They've been on imatinib for many years. They're doing well, but they've been diagnosed with the gastritis through an endoscopy, and they've been experiencing bloating, burping, regurgitation, dry mouth, skin and altered taste. What would be some ways to heal these symptoms or side effects with nutrition?
Sorry, I wasn't mute. Of course, well, I recommend you to try probiotics, especially Lactobacillus boulardii. But first, try to ask your oncologist if this recommendation is okay with you. Boulardii has previously been demonstrated to have a spectacular effect in this type of symptoms. Also, LRG has posted a few days ago some recommendations about the proper probiotics for you. Probiotics can help you through all these symptoms you are trying to tell me, and also you can try to incorporate a FODMAPs diet in order to help you to cope with the side effect. Remember, in the last meeting, I talked to you about a low FODMAPs diet, which might include a loss of, I don't know, to avoid high fat foods, high sugar foods. And often in some patients, also the gluten and the lactose can irritate and can perpetuate or aggravate these symptoms. So I will recommend you to try to reach the post of live Raft about the probiotics, to ask your physician about it, to try one of them, and of course to try to eat a low FODMAPs diet in order to get.
Okay. So there is a follow-up question about the probiotic. Sometimes people want to know like what kind, the prebiotic, probiotic, how much of it is recommended, and can the side effects of probiotics be bloating? And what specifics would you recommend?
Yeah, depending on the side effect you are experiencing or the symptom you are experiencing is the best probiotic you might feel better with, if I mean correctly. So there are, some probiotics can cause bloating, so you need to be aware of which one are the better. I would rather the ones that are mixed. Okay, so they tend to bloat the less to the patients. And also probiotics, remember, probiotics are the fiber. Is the fiber of food. You can also have probiotics, supplementation with probiotics, but it is only fiber, and fiber can cause bloating more than probiotics. Okay, so be aware to drink enough water. This is really important because I had a patient that I had her supplemented with pre and probiotics, and they told me, I feel bloating and I feel constipation. And I was like, oh my God, this is not doing well. And then I asked to her, are you drinking enough water? oh no, I'm not drinking water. Oh my God, that's why you are feeling bloated, or that's why you are feeling constipated. So it is important to use prebiotics and probiotics, but also it is important to drink enough water in order to get or to achieve the medical or the therapeutic approach with both of them.
Are you able to recommend any brands or milligrams, or should they speak to their physician or nutritionist?
I will recommend Boulardi. For Boulardi is the best option when you are feeling diarrhea. Boulardi families, and better to achieve 50 billions as a supplement that have more than 50 billions of Boulardi will be better for diarrhea. For bloating, that might be another type of probiotics, including lactobacillus in general. But I would, for diarrhea and for bloating, I would recommend Boulardi. These are the best options for this type of side effects. Or if you have specific symptoms, you can address me, and of course I could give you the best team player in order to achieve a better medical therapeutic approach.
Okay, good. And then somebody wanted to know about taking digestive enzymes. Do you want to address that, if that's recommended?
I'm sorry, I didn't understand.
Digestive enzymes.
Oh, yeah. Digestive enzymes are only when you have a yeast at the duodenum or ileum, because there are, remember, when we have a surgery in this scenario, we might be impairing pancreatic section. And so there is the only concern when I will recommend digestive enzymes. If not, you can use fiber, eat more vegetables, drink more water. I do not recommend it for all the patients. I only will recommend it for specific patients with ileum or duodenum yeast, or with a specific condition regarding her surgery or their surgery, including pancreatic section. But to all other patients, you can do it very well with drinking enough water and with eating healthier food.
Okay, there's been some questions about, does it help to alkaline your body? Looking at the pH equilibrium. Can you address that?
Yeah, well, there is not enough evidence to support this fact. The reality is our body needs to be equilibrated with a pH of 7 to work properly. I would only recommend to try a healthier diet and focus on modulating your microbiota, because microbiota modulation in cancer is well described. These do have evidence behind the recommendation. And of course, as I mentioned it in my presentation, recently it has become one of the hallmarks of cancer. So please try to focus more on maintaining an ideal body weight, to maintain an ideal good enough bacteria. And also the Mediterranean diet has demonstrated to be a healthier, non-inflammatory diet, and to focus to maintaining these ones in order to feel better. But alkalinizing your body is more like a myth and has not enough evidence to overcome.
Okay. So there's been some questions about protein intake. Should our protein intake be different than someone without GIST? Are there specific protein sources that are better than others? And then some people had said, what about an egg yolk a day, or whey being good? Could you address those as protein sources as well?
Yeah, you must be eating different amount of protein, different from other patients that do not have GIST. Okay, it depends, of course, in that's why a nutritional assessment is needed, because it depends if you are addressing some risk factors related to malnutrition in order to give you enough protein. But I will recommend only 1 gram per kilogram for you as GIST patients. But if you, I don't know, if you have anorexia or you have any symptom of cachexia, you might need some help regarding protein powders, right? Because of course, related to the surgery, you can also not be tolerating big amounts of food. You can be addressing some malabsorption problems here. So you might need helping with protein powders. But for this scenario, I will recommend you to get an RD consultation in order to get the proper benefit that you need or the amount specific that you might be helping with.
From a nutrition perspective, do you have any suggestions for minimizing the effects of contrast used in CT scans or MRIs?
Yeah, well, for MRIs and contrast CT scans, the main side effects are nausea and vomiting and feeling full. You can try to eat a low-fat diet and you can try, I don't know, chicken soup or foods that you tend to tolerate well, but try to avoid inflammatory vegetables, because vegetables are good, but there are some that are pro-inflammatory, and try to avoid them. And also, if you prefer, you can start with fruit and then go through chicken soup and then try to, I don't know, to progress that diet in order to tolerance it very well. And you can also try to address the tips I gave you before for nausea and vomiting, lemon drops, eat small amounts of food, and all these related to coping with this side effect.
Okay, great. There's somebody who has a side effect of edema. What, from a nutritional perspective, would you recommend to reduce the edema?
It depends on the side of the edema. So in order to get a better outcome, but physical therapy has recommended to alleviate more than alleviate edema feelings or pain related to edema. So I will recommend you to go through your oncologist and ask for a physical therapist in order to get, I don't know, massage and there are some, I don't know how to explain it, but massage and a proper physical therapy may help you. But regarding restrictions with diet, I don't know, some patients think that they have to stop drinking water because they are having edema, and that's not a good option. Okay, so please try to ask your oncologist more in a way to get a physical therapy consultation.
Do you know if there's a nutritional perspective on addressing hand-foot syndrome, which is a side effect of, for instance, sunitinib?
Yeah, head and foot syndrome has been related to a side effect of TKIs, but also with malnutrition. So it is really important for you to be aware you're having your ideal protein levels in your body, in your body cells, and you are not going through anemia, or your albumin is right. You have to be aware of that. And also you can try to, I don't know, walking is not a very good option for patients who have these type of side effects. You can try to go swimming, or you can try to do these exercises in bed. There are some exercises that may cause relief, and you can do it in your bed. So if you need, I have one videos from one of our medical therapists. If you need some, I can email to you. If he can email me the question, I can email them so he can feel a little bit better. But with nutrition, just be aware of your albumin and your protein levels. Then be assured that it is right. And if not, if it's not right, you might be addressing some risk factors for malnutrition, and you have to get a proper nutrition. Try to increase your protein intake. Try to help you with protein milkshakes. With protein milkshakes, I have one concern. Some patients first talk about protein milkshakes. They are good, but try to be aware of a good tolerance with protein milkshakes, because they might be so osmotic, and they can cause you inflammation and bloating. So I will recommend to try these protein milkshakes all along the day, a little bit sips all along the day, in order for you to can absorb all the nutrients, and in order to can tolerate them well. this is my huge recommendation.
Yeah, that's great. You're so resourceful. So much information. There's hopefully my connection's okay. There has been a belief that low sugar, low carbohydrate diets help starve cancer. Is a low carb diet such as a keto or a carnivore recommended? And then I also want to mention that, even the gluten-free, aspect has been mentioned. And does that address anything regarding gut health?
Well, starting with a keto diet, no, this is not a good option for us as GIST patients, okay? Try to eat a balanced diet, okay? Sugar is not feeding cancer, okay? This is a myth, okay? This myth has become because of the tomographies that we use, and we use sugar to can locate the tumor with the PETs. I don't know, but this is a myth. Okay, a keto diet might not work for you because you don't need this. Okay, you need a proper balanced diet. I will not recommend you a keto diet. I will recommend you to eat more natural sweeteners, like the fruit itself, right? Try to eat healthier, try to eat more natural, not so much processed meats or processed vegetables also, or processed, if you ask me, I want a juice, I have a juice and I have an orange, please prefer the orange, right? But not as a low carb diet. I will not recommend a low carb diet. I will recommend a balanced diet, okay? So regarding gluten-free diet as healthier, this is also a myth. There are some women here in Mexico. I am working in collaborating in some research from some anti-inflammatory diets regarding some other physical aspects or physical conditions, okay, or physical syndromes. And we have done some research regarding them, and there are some women, Latin American women, that cannot tolerate well the gluten. But there are very specific type of women in which I will recommend, okay, please avoid gluten, right? But to GIST patients, I do not recommend to avoid gluten. Only if you are feeling really bloated, or you are feeling really a lot of inflammation, I will restrict or reduce the amount of gluten and reduce the amount of lactose. Okay, because some patients cannot tolerate this very well, but it is not correct to say that a gluten-free diet is a healthier diet. No, right. A healthier diet is a balanced diet. Okay, that is a balanced diet, a healthier diet.
Okay, great. I think we're getting pretty close. I'll just do a couple more. Just looking, rather than the brand of supplements for probiotics or prebiotics, but a more natural form of it. Somebody was asking about kefir or sauerkraut, and prebiotic safe mortified, such as dark greens. Could those be more natural ways to get that?
Yeah, kefir is a very good option for probiotics. It's a very, very good option if you don't have problems tolerating lactose, because some kefir products have some of lactose. It is a very, very good option. Kefir is a really good option in order to get them more naturally. And the greens also is a better option. To probiotics, you have already a resource in fruits and vegetables. You
right.
Need to do it, do a hard or any other difficult strategies. In order to get probiotics, you can eat all your greens, and you are going to be okay.
Be okay. Okay. The last question is, where can I find a registered dietitian with expertise in GIST?
Well, well, you can get, well, I mean, when you're oncologist, if you are attending to an oncologist who is expert in GIST, Raft group has a huge, I don't know how to tell, a huge list of
Database.
oncologists, database of oncologists who are expert in GIST. You can address Raft group in order to get a proper oncologist who is expert in GIST. And I think that this oncologist who is expert in GIST has in his team or in her team a registered dietitian who is also expert in GIST. But if you need any other further consultations or you need any other information, please, you can contact me. I'll be happy to help to any other patient.
Okay, amazing. I think everybody would agree that Berenice is amazing. Like I said, I haven't met anybody else like her. She's very knowledgeable about GIST and how nutrition can be incorporated with that. So once again, excellent presentation. You're just so knowledgeable, so resourceful, and we really look forward to being in touch with you. If anybody has any follow-up questions, we can get you in touch with Berenice. But thank you all for attending. Thank you for your presentation, and everybody have a lovely day.